Good afternoon. Thank you so much for the opportunity to present here today. Thank you to Chan and Dr. Rowe and the whole HERA team for all they are doing to help us with COVID research globally. My name is Kristin Kostka, and I'm an Associate Director at IQVIA, and I have the privilege of being an investigator in the Odyssey community. I am very fortunate to have a unique role that involves expanding our international distributed research network to combat COVID-19. How does a research network grow? How do we evolve to a pandemic? It starts with the people. Mobilizing global research is a very human-driven activity, as you might imagine. You have heard from our colleagues that the study-a-thon phenomenon is a unique mechanism that we have available to us in Odyssey. At the beginning of the pandemic, back in March, in just 88 hours, we convened more than 350 researchers from 30 countries. And in that time, we published 9 protocols and released 13 study packages. But most impressively, we assembled a distributed data network of 37 data partners, including 8 sites. And those were colleagues from the US, South Korea, Spain, the Netherlands. And today, that network is growing. This was the catalyst that helped us grow and create a momentum that data needed to become available for more research. The Odyssey network is growing every day, and we are very fortunate that in these pandemic times, we have collaborators from the US, Europe, and Asia Pacific contributing their results to our community initiatives. We have hospital billing data, we have administrative claims data, electronic health records, electronic medical records, and we are very fortunate that in many cases, collaborators are even building linked data sets to help bridge the inpatient-outpatient experience in our longitudinal patient journey. This is an incredible amount of effort, and we are so grateful to have HERA be part of our network. It's challenging to capture this data, but we've already made great strides in what we have available to us today. Together, Odyssey has studied, as of today, 4.5 million patients tested for SARS-CoV-2. We have 1.2 million patients diagnosed or tested positive for COVID-19. And we have a sizable population, over 250,000, who are hospitalized with COVID-19. As you might imagine, there is a lot of power in this network, and there's a lot of activity we are doing to expand our reach. Our motivations for expanding our global network are manyfold. We have a desire for rapid collection of clinical, laboratory, and diagnostic data. We want to see the health plan. We want to see hospitals. We want to capture data during the peak. And as the pandemic evolves across the globe, we are in many different situations across different countries. There are critical elements to fostering and expanding a distributed research network. Speed, of course, is critical. We need to collect data now before the next wave in some places. We need to make access to information fast and easy and enable the sharing of results. And we want to extend our data models as we have the ability to meet new data elements and test and validate various ongoing data collection mechanisms. And of course, our ultimate goal is to help it create evidence. And we want to evolve to support the growing need to capture information for clinical trials. And so there are many initiatives that are happening across the globe that are making this possible. In the United States, the National Institutes of Health has adopted the Omap Common Data Model as the backbone for its national COVID-19 surveillance project. The National COVID Cohort Collaborative is a very large initiative spanning across a number of institutions in the United States using a variety of different common data models. You may not be familiar with these, but there are other models such as the Patient-Centered Outcomes Research Network, PCORNet. There's the ACT I2B2 network from our colleagues at Harvard. We have colleagues who have pioneered the Trinetics network, which is a proprietary network that uses a common data model. And together, these clinical data networks, alongside the Odyssey community, are providing leadership to the NIH to create data harmonization pipelines with a shared goal to improve the efficiency and accessibility of COVID-19 clinical data, and ultimately to figure out a way to create collaborative models in pandemic times to answer these important questions. This is a huge initiative, and it involves hundreds and hundreds of researchers who are working very, very hard on different work streams such as governance, phenotype and data acquisition, the data ingestion and harmonization process, building collaborative analytics, and even publishing synthetic data where possible. So why did they choose Omap for this particular initiative? The data told us to. When surveyed, potential sites were asked what common data models they currently use. Of the 4 options, Omap had the lion's share, or the majority of sites that were part of this. It's incredibly interesting to see some sites do support multiple common data models, but it became clear Omap was a robust model that could help with capturing this information and make it feasible to have more institutions join the research network. So how does this come to a practice? We're looking at a number of different data models that go into an ingestion pipeline. That ingestion pipeline actually harmonizes that information and turns it into a central Omap. Then that data is made available in limited or safe harbor data sets for collaborative analytics. This is a very unique situation. Unlike many other projects where we do not move data, this is a one-time opportunity that institutions have set up some data transfer agreements to create a central repository so that we have adequate sample size to study some of the most compelling questions that are facing us in COVID-19. And what does that look like in action? We have, as of today, 58 data transfer agreements executed across institutions in the United States. There are 43 sites who have obtained their IRB approval. 41 sites have executed both the data transfer agreement and have IRB approval to send information. There are 35 sites that are having data use agreements in place, which means they can access and utilize the information being harmonized. And 26 sites have actually sent data. And if you want to learn more about what this initiative is doing, there's a paper in JAMIA that talks about the rationale, design, infrastructure, and deployment of this. But most importantly, there's an enclave being created for research purposes, and it's a collaborative analytics approach. Distributed research is how we do the majority of our work in Odyssey. This is the left-hand column. We are looking at federated querying, where we ask a question and we send it to institutions and we get results back. In this limited instance, we actually have a private cloud where this information is being further harmonized. So these sites are creating a central analytics in a secure environment. This can be a node to other Odyssey network studies, and it also can be a place that researchers can go in and ask their own research questions. This is a collaborative model that is public and transparent, and researchers from institutions are invited to participate by following through the governance process. More information is available on this website, and you can rest assured that if you are designing network studies in the Odyssey network, you are collaborating in a consortia which allows us to run studies and contribute back results and allow this large asset to become available for our research purposes. This is an incredible opportunity as it has dramatically expanded our reach in the United States. We are having more institutions come online. We are getting more geographic representation, and we are having more information about all of the data that could be harmonized into the common data model. A key challenge in growing our distributed research network is understanding how sites are capturing information and how we can utilize that in common analytics. Where can we find mechanical ventilation data? How do we access and understand who gets ECMO? Perhaps we want to know what intensive care people are receiving. All of that often requires a very concentrated discussion with our researchers to understand what data elements they want to capture and how we can capture it in the data model. Therefore, a community like this N3C community allows us to have the ability to enrich our common data model with more information from sites, and it's really expanding the scientific impact of what we can capture in our measurement table, even in our specimens, And it's a very exciting time for us in the research community because now we can ask even higher dimensional questions. But this isn't the only thing that's happening in the global network. As some of my colleagues have told you earlier, our European network is completely exploding as well. There are lots of funded initiatives happening through Eden, and we see things like the UK Biobank, the Istanbul University Faculty of Medicine, and even Health Data Hub coming online. There are 25 grants out that are helping mobilize site data to become part of an Omap common data model instance that can be queried in the distributed network. This is incredibly impressive, and it shows the growing power of our initiative and the ability to mobilize our human power. Of course, we have institutions and companies who are helping create data pipelines so that other sites can buy data. I work for an institution that publishes data assets. We have a number of assets both from the United States and Europe that you can license to be able to run COVID-19 research, or you can work in the network of Odyssey. Truly, the power of the network is that we are growing every day. We are finding new ways to bring information into the common data model, and we are getting lots of public funding to be able to support this. It's an incredibly exciting time to be a researcher. It's a very trying time. We have a lot of information we still have yet to capture, but I believe that the network that we are building is going to become a powerful asset, and you will see many, many publications coming out of this community. And there's a global conversation that's going on around this integrated data network. We see our colleague, Dr. Prieto Alhambra, has the wonderful opportunity to help foster global research through some work that they have funded through the COVID-19 Therapeutics Accelerator. We have lots of opportunities to share our research in different forums. If you're a podcast listener, you may want to check out the recent podcast where we discuss our hydroxychloroquine study. And this is an opportunity to go from information to results to insight. And that's really the key part of building a big network. We are finding and understanding the global swath of what's happening in our patient populations, and we are sharing this information to empower researchers. And you might wonder, I have data, maybe perhaps I want to be part of this network. Becoming an Odyssey network site is a journey. It's part of committing to our philosophies of open science. It's also understanding who will build and write the extract, transform, load processes that take your data and put it into the common data model. And there's also the opportunity to run data quality checks to understand what you're capturing, what you could capture, and ultimately iterating through this using the common tools that are available through the Odyssey community, such as our Atlas platform. All of this comes together to allow you to be able to receive, review, and conduct network research as a node as part of this global collaborative. It's a journey, and it certainly takes time, but the good news is you have the support of the Odyssey community behind you. Every day, researchers across the globe are discovering the Omap Common Data Model and are finding ways to take their institutional data and to bring it into the Common Data Model and to become a node for network research. We thank the HERA community for all of their hard work that they have done in this COVID time. And it is very important that we say how grateful we are to have such a globally representative network, and your leadership has really brought us forward as a community. And of course, I'd be amiss if I did not say it's always a chance to join the journey. We can't wait to see where the network goes as the year progresses and into next year. I have no doubt that we will continue to pick up more information and have the ability to answer more questions with this network. Thank you again so much for the opportunity to present today. It is an incredible opportunity to speak with you.